Good evening. We are on to day 19 of our Advent calendar. Today I am going to talk to you a little bit about lateral hip pain. So pain on this outside part of the hip here. There's a number of different things that can cause this. It can be referral round from the back. So if you've got a sore back, you can feel that round into the outside of the hip. That's not what we're going to focus on today. Or it can be tendons, muscles. You've got something called a bursa on the outside of the hip. It can be the hip joint. So a few different things that can cause the pain. But there's a couple of exercises that you can do and gradually build up that are very unlikely to make anything worse. And they're a good starting point to try and get the hip stronger and get it moving a little bit better. Now, unfortunately, two cheeky elves have stolen my mat. They were obviously doing some gymnastics last night while we were sleeping. So I'm going to have to use the floor, but I'll just demo from here. So, first couple of exercises are slightly easier if you have a band. So you can use a loop band, or you can use a band that you tie into a loop, okay? If you don't have a band, you can do a similar thing using a wall, which I'll try and show you. But if you have a band that you can tie in a loop, or if you have a loop band, that's your best option, okay? So, what you're aiming to do from here is lie down. Okay, now I'm aware my head's disappeared, but you don't need to see that. It's my legs we need to see for this. So, you're lying down, okay? Now, say that it's my right hip that's the one that's giving me problems, okay? What you would look to do is just brace that leg out into the band and then hold, okay? And you hold in for maybe about 10 seconds and then relax. So you're not, to start with, doing an active movement with the hip. You're just trying to brace it into the band. If you need to, you can increase the tension by just taking the other leg away and trying to keep that right leg where it is, so that sore leg stays still. What that does is it gets the muscles around that outside of your hip working without actually moving anything, okay? So it's a really nice gentle starting point to get everything activating on the outside of that hip. Now, once you've got it working, you can increase the work by still keeping that right leg still, but doing an active movement with the other side. Okay, so the right leg is still working to resist, but it's the left leg, the non-sore leg if you like, that's doing most of the work here. Okay. Building up from there, you would then start to try and actually move the right leg, okay? So the left leg stays still and the right leg does its movement. And you wouldn't be building through these stages in a day, do you know? You would be working at stage 1, checking that you can do it, checking it doesn't make anything worse, for at least kind of 72 hours before you would start stage 2, and then same thing again. And you may find it takes a week at stage 1 before you can move on, okay? So stage 3 would be to actually get some movement through that right leg. Now you'll notice all of these have been done lying on my back, so you're not bringing gravity into it at all, okay? You don't move on to working against gravity until we're moving up onto kind of stage 4, if you like. So stage 4, you would then turn onto your side. Now bearing in mind my right side's my sore side, so I'm going to be lying on my left side. Okay, so you're lying on your left side. And again, you would start by just sort of getting some tension onto the band and then holding. Okay, so you're not doing a big movement, you're just tensioning and holding. Now what you can find is that actually if it's the outside of your right hip that's sore, you might not be comfortable with your leg all the way down here. You might have to put a pillow or a rolled up towel in between your thighs so that your starting point is a straight leg rather than a kind of adducted, a leg that's down the way. Okay, so you would work on bracing first, Okay, and then once you can manage that, you can then work on your active ups and downs. Okay. So that takes you through 5 different stages of you gradually building up, working through the outside of that hip. Now, as I said, if you don't have a band, either give us a call and we'll get one to you, or you can mock it up a little bit, certainly in initial stages, using a wall. Okay? Now, I'm going to use my left leg this time just because of the way everything here is set up. So you would be lying down. Okay, so now my left leg's my sore leg. So you're lying back and you're pushing that left leg into the wall. So again, just a static push to start with, no active movement, just a push and hold, and then relax. Push and hold, and then relax. And then you would build up by getting the movement of that leg, okay, without any gravity involved, without any resistance against it, moving out and in. And then you would be turning onto your side. So again, it's my left leg that's sore now, okay? And you can do a little lift and hold in that position. Again, you may be more comfortable with something in between your knees. So your start position is here, and you're just doing a little kind of lift and hold. And once you're comfortable with that, you would then move on to doing active ups and downs. Okay, so this is only if you don't have a resistance band of any sort to work with. Okay. What I would say is if you go in at level 1 and you try it and you find it's making your hip worse, you probably need to get an appointment so that we can have a look at it and point you in the right direction with what you're needing to do. And again, if you try and build up through the stages and things are not improving or they're worsening, give us a call, let us have a look at it. But if you can manage to build through these stages, you should find that your hip is gradually able to tolerate that little bit more loading, and that's hopefully reducing your pain levels day to day in the background as well. It's okay to be slightly uncomfortable when you're doing these, as long as you're not sore for kind of a prolonged period afterwards. So as long as the pain is settled within about 20 minutes afterwards, you're all right. And as long as you're not provoking pain that's above maybe a 3 or 4 out of 10, you're okay. It shouldn't be a sharp pain, but a little background ache while you're doing the exercises is fine, as long as it settles afterwards and you're seeing a general pattern of improvement. So give it a shot if you've got sore hips, see how you get on, let us know how they feel. If you need some bands, get in touch, we've got loads. I'm more than happy to send those out to try and help people. Enjoy, and I will see you again tomorrow. Bye.